11:47 p.m. Intensive care unit. General Hospital. The monitors are screaming. A 73-year-old grandmother is fighting for her life, and she's losing. Her family surrounds the bed, but there's only one person in that room who knows exactly what's about to happen, who's seen this moment 26 times before, who will hold this woman's hand as she takes her final breath, then clock out, and drive home to her own family. In 18 minutes, Jessica Rodriguez will experience something that will haunt healthcare workers forever. She will become the last human connection for someone leaving this world. And tomorrow morning, she'll do it all over again. This is the story of the ICU nurse who's held 27 hands as they grew cold, who's watched 27 families shatter, who's witnessed 27 final moments, and who still believes this is the most important work she's ever done. Meet Jessica Rodriguez, 39 years old, critical care registered nurse with 14 years of ICU experience. Every morning at 7 a.m., she walks into one of the most emotionally devastating environments in healthcare, the intensive care unit at General Hospital, where the sickest patients fight for their lives, where families make impossible decisions, where hope and heartbreak exist in the same room, sometimes in the same heartbeat. Jessica's assignment board typically shows 8 patients, 8 people hanging between life and death, 8 families living the worst days of their lives. But Jessica doesn't see patients. She sees stories that haven't finished yet. The ICU runs on protocols, procedures, and precise interventions, ventilator settings, medication drips, vital sign monitoring, family updates every 4 hours. Jessica does all of that. But she also does something you won't find in any nursing manual. She pays attention to the moments between the medical tasks, the space where fear lives, where families need someone to explain not just what's happening, but what it means. Room 314. Harold Patterson, 68 years old, retired construction worker. Massive heart attack 3 days ago. His daughter Amy hasn't left the hospital since the ambulance brought him in. Room 318, Maria Santos, 54 years old, car accident, traumatic brain injury. Her husband and 3 teenage children take shifts holding her hand, playing her favorite music. Room 322, Daniel Kim, 23 years old, motorcycle accident. His parents flew in from Seattle. They don't speak much English, but grief is universal. Each room tells a different story. Each family faces the same terrible uncertainty. What most people don't understand about ICU nursing is that it's equal parts medical expertise and emotional archaeology. Jessica doesn't just manage life support systems. She manages life support for entire families. She explains why someone on a ventilator can't talk. She teaches families how to touch someone connected to machines without being afraid. She translates medical language into human language. The numbers on the monitor don't tell the whole story, she says. Your presence does. Your voice does. Your touch does. 12-hour shifts. No weekends off this month. Mandatory overtime when they're understaffed. Jessica makes $34 an hour to carry emotional weight that would crush most people. She's missed her daughter's soccer games, her son's school plays, family dinners, birthday parties. The price of being available for other people's most critical moments is sometimes missing your own. But she keeps coming back because someone has to be the steady presence when everything else is falling apart. October 15th, 11:30 p.m. Jessica was finishing her shift when the call came in. Emergency admission. 73-year-old Eleanor Martinez. Massive stroke. Family en route. By the time Eleanor's family arrived, Jessica had already started the process she'd performed 26 times before. Establishing 4 access, connecting monitors, adjusting the ventilator, administering medications to keep Eleanor comfortable. But Eleanor's condition was deteriorating rapidly, and Jessica knew what the family didn't yet understand. This wasn't going to be a story about recovery. At 12:15 a.m., Dr. Peterson delivered the news no family wants to hear. Eleanor's brain activity was minimal. The stroke had been massive. The kindest thing they could do was transition to comfort care. Jessica had watched this conversation happen dozens of times. The disbelief, the anger, the bargaining, the desperate questions about miracles and second opinions. What makes Jessica exceptional isn't just her medical skills. It's her ability to hold space for families' grief while helping them make the most loving decision they'll ever make. She can hear you, Jessica told Eleanor's family. Tell her what you need her to know. Tell her about the grandchildren. Tell her about the garden she loved. Tell her it's okay to go. Jessica had learned that families need permission to let go. They need someone with medical authority to tell them that choosing comfort over aggressive treatment isn't giving up. It's choosing love over fear. For the next 47 minutes, Jessica managed Eleanor's transition from life to death with the same precision she'd use for any medical procedure. She monitored Eleanor's breathing, adjusted pain medications, ensured her positioning was comfortable. But more importantly, she monitored the family's emotional state. When Eleanor's grandson started to panic, Jessica showed him how his grandmother's breathing was peaceful, not labored. When her daughter couldn't stop crying, Jessica brought her a chair and a glass of water. When her husband of 51 years whispered that he didn't know how to say goodbye, Jessica said, "Tell her about the first day you met her." At 1:02 a.m., Eleanor Martinez took her last breath. Jessica was holding her left hand. Her husband was holding her right. Her children and grandchildren surrounded the bed, connected by grief and love, and the profound privilege of being present for someone's final moment. Jessica had witnessed this transition 26 times before, but it never became routine. Each death was someone's mother, father, spouse, child. Each death left a family forever changed, and each death left Jessica carrying a piece of their story. After Eleanor's family left, Jessica spent another hour completing the medical and legal requirements that follow every death. Documentation, notifications, coordinating with the morgue, preparing the room for the next patient, the administrative side of death that families never see, the paperwork that transforms a human being into a case number, a statistic, a bed that needs to be cleaned and restocked. But Jessica remembers every name. Eleanor Martinez became number 27 on a list she never wanted to keep, but can't forget. Jessica clocked out at 3:24 a.m. She drove home through empty streets, past closed businesses, and sleeping neighborhoods. People who had no idea that Eleanor Martinez had just died, or that a nurse named Jessica had held her hand through the transition. At home, Jessica's family was sleeping. Her husband, her 2 teenagers, her elderly mother who lived with them. People who depended on Jessica's strength, her presence, her ability to show up for their lives. But how do you transition from holding a dying stranger's hand to kissing your own family goodnight? How do you carry the weight of other people's grief without letting it crush your own capacity for joy? This is the impossible balance ICU nurses navigate every day. They witness the worst moments of human experience, then drive home to their own lives, their own families, their own fears about mortality and loss. They hold space for other people's grief while managing their own trauma from watching so much suffering. They provide emotional support for families while rarely receiving it themselves. 7 hours later, Jessica was back at City General. New patients, new families, new stories of hope and heartbreak. Room 314, a 42-year-old father recovering from emergency surgery. Room 318, a 19-year-old college student fighting complications from meningitis. Room 322, an 80-year-old woman whose family was flying in from across the country. Each assignment a reminder that the ICU never stops, that families need someone who understands the difference between medical care and human care, that someone like Jessica will be there when they need her most. Over 14 years, Jessica has administered thousands of medications, managed hundreds of ventilators, started countless IVs. She saved lives, extended lives, and helped families navigate the end of lives. But when you ask her about the most important part of her job, she doesn't talk about medical procedures. She talks about presence, Medicine can keep someone's body alive, she says. But what keeps their humanity alive is connection. Knowing that they're not just a room number or a diagnosis. Knowing that someone sees them as a whole person, even when they can't advocate for themselves. These hands have started over 10,000 IVs. They've performed chest compressions during codes. They've administered life-saving medications in crisis situations. But they've also held hands during the scariest moments of people's lives. They've wiped tears from faces of people who couldn't move. They've provided comfort when no medical intervention could help. 27 times these hands have been the last human touch someone experienced in this world. The ICU runs 24 hours a day, 7 days a week. There's always another emergency, another family in crisis, another impossible decision to navigate. And there are always nurses like Jessica who choose to show up, who choose to carry the emotional weight of other people's worst days, who choose to be present for moments that will haunt them forever. They don't do it for recognition. ICU nurses rarely get thanked by patients who recover. Most people don't even remember their time in intensive care. They don't do it for money. The pay doesn't come close to compensating for the emotional toll. They do it because someone has to. Because families shouldn't have to navigate medical crises alone. Because dying people deserve to have their hand held by someone who cares. Not every story in the ICU ends with death. Jessica has also held hands during miraculous recoveries. She's watched people wake up from comas, breathe without ventilators, walk out of the hospital when everyone thought they wouldn't survive. She's been there for first words after weeks of silence, for reunions between patients and family members, for moments when hope transforms into reality. These moments sustain her. They remind her why she became a nurse, why she continues to show up, even after holding 27 hands as they grew cold. Right now, across the country, there are approximately 200,000 ICU nurses providing critical care to the sickest patients in our healthcare system. They work 12-hour shifts in high-stress environments. They make life and death decisions every day. They provide emotional support for families facing unimaginable circumstances. They witness more human suffering in a month than most people see in a lifetime. They carry the emotional weight of strangers' grief. They sacrifice time with their own families to be present for other people's families. And they do it for an average of $34 per hour. These aren't just healthcare workers. They're grief counselors who understand medical equipment. They're family therapists who can manage ventilators. They're spiritual guides who speak fluent medical terminology. They're the steady presence when everything else is chaos. They're the knowledgeable voice when families don't understand what's happening. They're the compassionate touch when patients are scared and alone. They're heroes who punch a time clock. Heroes who work holidays and weekends. Heroes who come back day after day to do work that would emotionally destroy most people. And most of them have never been thanked for the lives they've saved, or the deaths they've made peaceful. When I asked Jessica how she continues to do this work after everything she's witnessed, her answer was both heartbreaking and inspiring. Every person deserves to have someone who cares about them in their final moments, she said. Every family deserves to have someone help them through the worst day of their lives. If I don't show up, who will? Those 27 people trusted me with their last breath. Their families trusted me to help them say goodbye. That's not a responsibility I take lightly. It's an honor I carry with me every day. If Jessica's story opened your eyes to the incredible work ICU nurses do every day, share it with someone who needs to understand that critical care is about more than medical procedures. It's about providing humanity in the most inhuman circumstances. If you know an ICU nurse, take a moment to acknowledge the emotional weight they carry. Tell them their presence matters as much as their medical skills. Tell them the comfort they provide to families is as important as the care they provide to patients. And if you are an ICU nurse watching this after a difficult shift, remember Jessica's words. You're not just managing medical crises. You're managing human crises. You're not just saving lives. You're honoring lives, even when they can't be saved. Every hand you hold, every family you guide, Every moment of comfort you provide matters more than you'll ever know. Subscribe to The Quiet Brave for more stories about the people who show up for us when we need them most. Hit the notification bell so you never miss a story that might change how you see the heroes working around you every day.